Hey, this is Jason Lofton, and I'm here with Dr. Randy Walker. And we just want to bring y'all a brief update on coronavirus and the vaccine in general. We're hearing a lot of people have anticipation or some anxiety about the virus or the vaccine. And we just want to come to let you know that we're looking at this as your local providers. We're looking at this data. We're looking at what other doctors are saying, other experts are saying. And so far, everything looks really good. We want to get our community vaccinated so that we can get rid of these masks and get rid of the social distancing and get back to life as normal. Dr. Walker's been studying data. He and I talk, we share information, and we just want to come to y'all to let you know that you can trust the news that we give you is not political. We're not being paid by the government. I wish they were paying us because it'd be nice, but they're not paying us. And let Dr. Walker just give his thoughts on that, and we'll tell y'all.
Well, these the Pfizer, Moderna, and AstraZeneca, they're all a new type of vaccine, and they should be some of the safest vaccines that's ever been created. And we're really fortunate to live in the times that we are, because technology has grown so much over the last few years that it's allowed us to respond to the pandemic and develop these vaccines in record amounts. Short time. Yeah,
and one of the things that people are concerned about is the speed with which the vaccines have been developed compared to the past. Well, one of the things is technology has allowed that to happen, but also the government has stepped out of the way. President Trump created the Operation Warp Speed. They removed a lot of red tape, so now the government gets out of the way so these companies who are developing these vaccines can get this stuff done quicker than what would have happened on a normal process.
Plus, they already had these viruses mostly sequenced, because it's similar to the ones they had in 2004 and 2008, the SARS-1 from then. And these have been in bats in South Africa. That was a fairly deadly pandemic there, and they've had that sequenced.
Yeah, and just the sharing of technology, just like Dr. Walker and I share information. If we see, we don't share patient data, but if we come across something, we say, hey, watch this. How are you treating this? The scientists from China and England and Brazil and all over, they can work together through the computer networks to share the sequence, to do it as a team instead of one person having to do it. I know we don't know when. Arkansas has received their first batch of vaccines. That's mainly going to the hospitals, and we'll be going to the nursing homes. We as frontline workers will get ours after that, local first responders. We don't know when that's going to be yet. We're anticipating January, February, maybe for some of our 65 and older and 55 and older with some medical conditions, but it's coming. We do need 70% or more of the population trying to get this to try to move on to normal. If enough people don't take it, I'm afraid it's going to keep lingering. We're just going to be stuck in this limbo.
And we only need a certain portion of the population to get vaccinated to basically turn the tide. Once we get to herd immunity, they call it, where one person infects less than one other person, the incidence of the disease will just die away in the environment.
Yeah. And so, for some of y'all that like to travel, more than likely there's going to be some travel restrictions related to vaccines. I'm encouraging people to take it, get it while you can, because that way, if you do want to travel or you do want to do some of these things, that's not going to be a holdup for you. We understand not everybody's going to take it, and that's fine. And we don't have to have everybody taking it, but we do want y'all to know that what we're seeing is safe. This isn't. This is different companies. We have a lot of independent players who are analyzing the data, and everybody agrees that it looks good.
Yeah, I agree. There's no reason not to take this virus. Not to take this vaccine, excuse me.
Yeah, if you've taken the flu shot, if you've taken the tetanus shot, if you've taken pneumonia shot, shingles vaccine, any of these previous vaccines, this is the safest we have, because modern day technology lets them make them safer and analyze them, and everybody's involved in this now. We'll be bringing you more information as we get that, and we just appreciate your time.